Health and Aging and Insurance subcommittee of this conference committee process. Let me just, I guess I'll just quickly introduce all the assembly members up here. For those of you who don't know who we all are, there's me and Mr. Cahill and Mr. Simbrowitz, Mr. Brindisi, Ms. Davila, Mr. Kim, Mr. Rea, and Mr. Walter.
Thank you, Assemblyman Godfrey. Myself, Kemp Hannon, David Valesky, William Larkin, who's not with us today, Sue Serino, Martin Golden, and Gustavo Rivera. I said them second. And it is the Budget Conference Committee for Health, today being March 16th. And we want to start off by appointing secretaries respectively for the Assembly and for the Senate. And for the Senate, it would be James Egan, who assures me that his penmanship is great coming out of a Catholic school system.
And on the Assembly side, it is Anthony Kurgaravat, who I think types really well. I have no knowledge of his handwriting. Yeah.
So we can start with opening remarks.
Okay.
Let the Assembly go first.
Okay. Well, mindful of the reality, which is that the budget negotiations are actually a three-way process, but nevertheless, just to run through some of the key things that are in the Assembly's budget proposal. One is restoring New York City back to what would be its appropriate local share for the payment towards Medicaid, not the governor's proposal. We reject the governor's various proposals relating to prescription drug pricing under Medicaid, and instead would restore the role of the preferred drug program in negotiating drug prices and administering the drug benefit under the Medicaid program. We, both in the Health Article 7 and in other bills, provide funding for implementation of the proposed increase in the minimum wage, including providing funding for health and other human services workers, and in particular having language in the public health law that would make sure that particularly in the area of managed long-term care, but not only in that area, the managed care plans would not only be paid enough by the state so that workers could be paid according to the minimum wage, but making sure that the managed care plans then pass the money on to their provider agencies so that they can pass the money on to the workers.
Everybody make comments first to open up.
Oh, I thought we were just going to rattle through?
No, I will let people make comments too. Then come back to your rattle through.
Oh, okay. We'll do that.
Well, I just start off by having Senator Serino make any opening comments she wants to make. She's also chair of our Aging Committee.
Good afternoon, everyone. While there are several important initiatives to be resolved, I'd like to highlight one budget item important to our seniors. The Senate included a $3 million increase for the community services for the elderly, known as CSE. This increase is critically necessary to reduce the waiting list. I hope that this is an area that we can reach an agreement on to better serve our growing aging population. Thank you.
Kevin? Or Steve, you want to talk about aging?
Sure. Good afternoon, everyone. The senior population is increasing exponentially, and we need to be prepared so that we can support our older adults living in the community and in their homes. There are almost 53,000 older adults living in areas served by a NORC or a neighborhood NORC. And right now, there are almost 3.7 million older adults living in the state. I look forward to working with my colleagues to focus on the challenges facing our seniors and strengthening their supports for the future.
Senator Valesky, Vice Chair of the Health Committee.
Thank you very much, Chairman Hannan. I would just raise one issue and highlight one issue in regard to the Senate's budget position in health. As Vice Chair of the Health Committee, I've been working closely under Senator Hannan's leadership and with Senator Seward, the Chair of the Insurance Committee, in regard to the Health Republic issue. The Senate has advanced a three-pronged approach in regard to identifying resources in terms of payments to providers, a liquidation process of the assets of Health Republic, and addressing the prior approval statute. So I appreciate the support of my Senate colleagues in advancing that issue.
Kevin?
Hello, everybody, and thank you, chairs, for hosting this meeting today. There are a number of issues that we will all be talking about, but I will be primarily responsible for insurance issues. And on that note, I would just take this moment to formally welcome the acting superintendent, Maria Vullo, probably not here, but we did receive correspondence from her, and I forwarded that to members of the Health and Insurance Committees, Ways and Means and Finance Committees of the two houses, pursuant to the joint Ways and Means budget hearings that were held earlier this year. The Assembly proposal with regard to the Department of Financial Services accepts the executive proposal with regard to state operations, aid to localities, and capital projects. We do take some exception to some of the matters going forward on Article 7. We modify the governor's proposal regarding excess medical malpractice and eliminate the provisions that would have modified the program's eligibility standards, and instead we extend the program for 1 more year. In addition, we add language to extend the Entertainment Workers Demonstration Program using the $250,000 appropriation that was included in the executive budget. And lastly, we've directed the Department of Financial Services to work with the Department of Health and New York State of Health to address issues relating to the closure of Health Republic, including but not limited to determining the value of existing assets and liabilities of Health Republic, developing policies and procedures to prevent similar closures during a policy term, and evaluating options to providers that are impacted by such closures. I would also add that I hope we get an opportunity to talk about the needs of those members who were transitioned from one plan to another, that making sure that they are kept whole in the process.
Senator Rare.
Thank you, Senator Hannan. There are many issues that still remain unresolved as far as I'm concerned, because there are disagreements between the Senate and Assembly. One House, a couple that I want to underline, particularly because of the position of the Democratic Conference. First things first, as far as the positives, as it relates to uncompensated care pool that related to a mistake that was made that impacted community health centers across the state to the tune of $54.4 million. I'm glad to say that both the Assembly and the Senate included versions of that money in there. So I am hoping that this means that we will have a resolution for community health centers across the state. As far as the things that are not in the Senate One House, that were not in the Senate One House, in particular, the local shares that refers to New York City contribution of Medicaid expenditures is incredibly concerning to the Democratic Conference, and I'm thankful for my Assembly colleagues that included it in their One House. It was unfortunately not included in the Senate One House. As well as as it relates to the Ending the Epidemic report that was put out last year, and the money that should be attached to it, the things that we need to, the money that we need to commit to make sure that we can end AIDS by 2020. There are different numbers that are floating around. I'm glad that we're at least discussing it, and I'm hoping that we can get to a number of 70 million, which is what the advocates have been asking for. Besides that, I look forward to working with my colleagues as it relates to Health Republic. There are many proposals that are around. There is a recognition that there are services that have been rendered that need to be paid, and we want to make sure that we can help the providers that have provided these services so that they can continue to exist. And with that, I do hope to work with my colleagues to be able to get all this work done so that we can get a budget on time. Thank you.
Thank you, Senator.
Mr. Rea?
Thank you, Chairman. The Assembly Republican Conference is particularly concerned with the governor's proposal and the Assembly One House proposal to increase the minimum wage to $15 an hour and its potential impact on Medicaid service providers. The Senate did not include that in their One House bill. And we're particularly concerned, and if it does become reality in the final negotiated budget, we'd ask that the state fully fund any new minimum wage mandate without negatively impacting the Medicaid global spending cap. It's estimated that in the first year alone, for just hospitals, nursing homes, and home care agencies, their costs would be $379 million. With respects to OPWDD providers that provide services to our most fragile in New York State, their cost in just the first year is estimated at $270 million. Going forward, when fully implemented, those numbers obviously go up. The Assembly's One House budget version did put $200 million in, but that was for everybody, from labor and health and everything else. And obviously, that's just a drop in the bucket as to what the cost in just the first year alone would be. Thank you.
All right. And the last senator, Senator Golden. Comments?
I really have no comments, Mr. Chairman. I'm looking forward to the tabletop discussions. I'm obviously looking forward to making sure that our pharmaceutical industry is working well, both neighborhood pharmaceuticals as well as our larger pharmaceuticals here in the PBMs, and working with the pharmacy units across our state. But other than that, I have very little to say at this moment until the tabletops are made public. Thank you, sir.
We're noting a historic first.
Wait till next week.
Assemblyman Gottfried, you have all these extra members of your house here, but that's all right. They showed up, and we should let them talk.
Well, I think at least several of them would like to say something. Mr. Walter?
Okay, yes, please. Thank you. Thank you, Chairman. While we appreciate the fact that the issue regarding Health Republic has been addressed, there's been no actual funding identified or a real plan in any of the proposed budgets. Failing to address the collapse of Health Republic leaves $200 million outstanding that's owed to our hospitals alone, not to mention what our other healthcare providers are still owed. And this isn't just a failure of Health Republic, but this is a failure of DFS and of the ACA itself. So let's not hold our healthcare facilities accountable for a failure of both the DFS, Health Republic, and the ACA itself. So we would encourage that there be some sort of identification of funds to address this $200 million shortfall that all of our struggling healthcare agencies are subject to at this point. Thank you.
Do the other Assembly members want to add anything in? No? Okay, if not,
Back to your list.
back to my list. Okay, so we were talking about minimum wage in the area of capital. We propose restoring last year's $300 million for the Oneida hospitals, $195 million for capital for hospitals, and $25 million for community health providers of various categories. With respect to public hospitals, meaning particularly the New York City Health and Hospitals Corporation, the 3 county public hospitals around the state, and the SUNY hospitals, we are proposing a $100 million fund for rate adjustments to be distributed on the basis of Medicaid discharges. In relation to HIV, there is money in the Assembly's budget proposal dealing particularly with supportive housing related to people with HIV, but that will be discussed at the housing table. Relating to retail clinics, the Assembly has once again rejected the governor's proposal for allowing corporate ownership of a retail clinic that is organized under Article 28 of the Public Health Law, but we have included in this year's budget bill language in an Assembly bill relating to retail clinics that, regardless of who owns a retail clinic, would define them and restrict them to what are truly drop-in episodic services so that they cannot blossom into full-blown corporate-supported healthcare providers. For school-based health clinics, we would extend for 1 year the carve-out of those clinics from Medicaid managed care. Similarly, for the traumatic brain injury and NHTD waiver populations, we would provide that they can only be transitioned into managed care if the program elements of those two waiver programs, as they have previously existed, are kept intact. In the area of medical marijuana, we propose to increase the number of dispensaries that a registered organization may have from 4 to 8, and to require the health department this year to register 5 additional registered organizations, which would increase the number of dispensaries, putting both of those pieces together, from 20 to 80. For the essential plan that we enacted a couple of years ago under the name of the Basic Health Plan under the Affordable Care Act, which, as many of you know, provides coverage for a great many immigrants for whom the state had been paying for their Medicaid coverage. We would extend that to a small but important additional population of what are known as the DACA immigrants who are as lawfully here as the other immigrants that the program now covers, but because of the wording of the federal regulations, would need to be funded exclusively by the state. The last thing, the $54 million indigent care funding for community health centers and several behavioral health providers that the executive branch has, I think, conceded they have kind of dropped the ball on getting the federal matching money for that. We would provide on a contingent basis, if the federal money does not come through, that could be funded out of money in one of the HICRA pools. Those are some of our highlights.
All right, so, and the Senate has a number of highlights also, but I wanted to note that there's several that we agree with the Assembly, or vice versa, the Assembly agreed with the Senate. Depends on whose press release is going out first. We rejected the 2-year Medicaid budget going to 1 year, rejected the pharmacy provisions, rejected the transportation carve-outs, rejected the spousal refusal provisions. We think they're counterproductive. Agree with the delay in the carve-in for school-based health centers. And when it came to the TBI, we actually have each house has 2 bills in. The one that I prefer is saying that we're not going to move the population that's subject to the TBI waiver into managed care. I think there's been sufficient arguments made that it's just not going to work out for that population. The excess medical malpractice, it had been proposed by the executive to sharply decrease the coverage of that, which would have had the effect of being, have a disparate effect on geography, and we reject that. We reject the early intervention program changes, but the Senate would say the experiment with the fiscal agent that was, we had acceded to the administration a couple of years ago to go do that. It hasn't worked out. There's no need for us to have an external fiscal agent. We think the comptroller of the state should do that work, and we could save that money. We agree on the changes to the Equal program for the assisted living, and then the Senate has proposed, and I think we have agreement that there should be some real changes and added some money to the doctors across New York. Both the procedures for contracting, the procedures for awards, and the sum total of money is not sufficient, and it is truly a medical lifeline for rural hospitals and sometimes some of the inner city hospitals. We also restore the funding for Oneida, the $300 million, and we have in our capital proposal identified a certain percentage that would go to community-based providers. We have changes that we are discussing in depth in regard to NORCs, eligibility, scope, money, whether or not they need to be rebid or not. Health Republic. First of all, we would say that the DFS should declare that they need to be liquidated. We need to go through that process in order to ascertain, A, whatever the assets may or may not be to that corporation. And second, B, we need to have a procedure so people can make a set of claims as to what they feel they're owed. Currently, we're all operating on informal surveys by the providers, by their respective trade associations as to what people feel are out there. Then in regard to once you get to a liquidation, we feel that there should be identified one of the settlement funds as the corpus for the liquidation, so that out of that, once claims are made, one of those settlement funds that have been brought either by DFS itself or by the Attorney General, that could be made available as a source for funding. It's one-shot funding for a one-shot problem. We don't feel that the guarantee fund is the way to go at this time. We have a few other things in regard to, especially the Health Republic, the prior approval process. We believe that the current prior approval process has led to poor judgment, has led to impairment of the companies that are operating, has led to artificial setting of the rates, and will have a deleterious effect on future healthcare companies unless we change it. Now, people would say, well, without prior approval, it's unfettered. What are you going to do to control things? We have a very firm federal and we have a very firm state medical loss ratio, which means a certain percentage of the monies taken in as premiums must go to healthcare. And if somehow the insurance company doesn't allow enough to go to healthcare, anything in excess has to go back to the people who are covered. So the premium dollar gets returned to those who are covered. It's a self-operating thing that protects both the patient and really the process for the future. We differ on the retail clinics sharply with the Assembly, given the fact that we have widespread people making money in regard to health care. We have widespread people making money in regard to urgent care. We see no reason that you can't have a publicly traded company such as CVS, which is hardly a nefarious company doing all the things they've done, like cutting out sale of cigarettes in their stores. We think they should be able to do it. So we have put in the provision that the executive has suggested, and we're going to be strongly arguing for that. The few other things, there is provision in our resolution in regard to going back to what this legislature and the executive did in 2011 in regard to the Medicaid redesign team. We call for a review of the accountability process. We call for the mechanism that operates the global cap, the call for greater transparency in the global cap, greater reporting. Underlying all of that is the reports that we're getting in regard to the effect of current funding levels for the long-term care system. And that includes the fact that to an entity, the home care people that are coming in are saying they're not getting paid on time and they're not getting enough money. We have the people who are having Medicaid patients going into their nursing homes, which is a very quickly escalating number, saying, well, they're not getting paid very quickly, and they're afraid when the temporary rates go out of effect in a year that they won't be paid enough. And the interesting part is, who are the people doing the paying? Well, it's the MLTCs, Managed Long-Term Care Companies, basically insurance companies that were set up or expanded mightily under the MRT. They come in and start talking about how well they're doing. They're not. 2/3 to 3/4 of them say they're losing money. So that's our long-term care system. And it leaves us very fearful as to how viable it is, how strong it is going forward. And as one of the assembly members said, it's the fastest growing part of our population. So that's why we want to have an accountability process. We also look through elder abuse. We have testing of the sexual assault kits. We go in Lyme disease and heroin. We have $1 million that we propose in connection with transplant and organ donation. We have provisions for an SSI rate increase. These are the adult homes. These are the adult homes that haven't had an increase, that we've had testimony 2 or 3 years in a row at the budget hearings that people are leaving that population. And once an individual covered at an adult home leaves the population at $20 a day, that's the state rate, where are they going? They're going into nursing homes at 2 and 3 times that rate. So it's not a good system. And lastly, we have a whole provision in regard to prescription drug gouging to deal with the situation, what happened with the touring company when they went from $13 a tablet to $750 a tablet overnight. Talk about gouging, that's drug gouging, and so we propose that. So we have a lot of work to do. I don't know if I've set off more things in your mind, but and I don't know if anybody else wants to add in, but that's all I have to rattle on.
Good list to start with. And yes, we do have our work cut out for us, particularly since it's not just the Assembly and Senate, but we've got those other folks to deal with.
And they're always so amenable.
Yes, to some things. Okay, before we get into trouble, shall we recess the meeting?
Recess.
Okay,
Anyone else?
done. See you all. Anon.